So now I'm going to go ahead and take a urine specimen, a sterile urine specimen from Tim's catheter. I've already checked Tim's identity, made sure it matched my chart, and I explained to Tim what I was going to do. So the provider has ordered a sterile urine culture and sensitivity, so I'm going to go ahead and do that right now. The thing with this is you want to make sure that you actually have an order for it. So check your order and see what the physician wants, or the provider. Okay, so I already have a sterile specimen collection cup. It's sterile because it's, the seal isn't broken. I've already labeled it with the patient's information, and I'm going to go ahead and begin. All right, Tim, I'm just going to go ahead and get a urine sample, and I'm just going to take it from your Foley, from the tubing there. And so you shouldn't have to do anything. I'll just get this done and we'll leave you alone, okay? All right, so I'm just going to go ahead and expose what I need to. And this is the port that I'm actually going to take the sample from. Now, a good word of advice is a lot of times the urine that is in the tubing may have been sitting there for a while. So you're going to go ahead and you would want to drain the urine that's in the tubing out first. And then what you're going to do is you're going to clamp the tubing for about 15 minutes. And then you would return back and take your sample so that you have fresh urine. So let's say that I've already done that, I've clamped, I've got fresh urine, and I'm going to go ahead and proceed. Okay, so the first thing you're going to want to do is clean off the port that you're going to be taking the sample from. So again, this is like a Luralock port. It's got a back valve on it, so nothing's coming out of it. This port, again, remember, is for the balloon, so we do not want to be taking anything out of there. That's not even in the bladder. I mean, that's not anything that's draining urine. It goes right into the balloon. And then we will need at least a 10 cc syringe. If you wanted to get more volume of urine, you would probably want to do a 20, you'd still use a 10, but you would want it to draw up 20 cc's instead of just 10 cc's. But you don't want to use too big of a syringe. You want to stick with a 10 cc syringe. So what we're going to do is we're going to put that right on the port here. And it's a Luralock, so you kind of have to push in and turn it and twist it. And then we're going to go ahead and draw the amount that we want. And we're not going to get a lot of urine right now because we're in a mannequin. But then once you draw up your 10 cc's, keep the tip sterile. Don't touch it on anything. Open your container. Put that cover upright. And then as you're putting the urine in, do not touch anything. Just put it right in the middle there because you don't want to contaminate. Okay. And then we're going to go ahead and put the cap on, keeping our sterility of the container. And then you're going to have your biohazard bag right here. Now you notice I didn't really touch any urine, so I'm okay with my gloves as such. But if my gloves got contaminated, I would want to change those. All right, so this is already now in my biohazard bag, so that's ready to go. I'm going to tell the patient I'm done. So I'm all done with this, Tim. I'm going to unclamp it, and I'm going to cover him back up. And we're going to discard our garbage and make sure that he is safe and comfortable. Side rails are up, bed locked and low. Call light is in reach. Tray table is in reach. And ask him if he needs anything before we leave. Tim, how are you doing? Do you need anything before I leave?
No.
Okay, great. Well, let me know if you do. I'm going to step out now and be back in about an hour or so. And I'll get this to the lab. Thank you.